Addiction is a chronic relapsing disorder that is characterized by compulsive use to use drugs that results in negative or catastrophic consequences. Hi, my name is Dr. Rachel Rabin. I'm an assistant professor at McGill University, and my research focuses on substance use disorders and really looking at the clinical, cognitive, and neural aspects of how substance use disorders affect the brain and these other outcomes. Right now, we're studying two populations. One is people with psychosis, so across the spectrum, people who are experiencing their first episode of psychosis all the way to full-blown schizophrenia. And we're also studying people who are cannabis users who also co-use tobacco. And the reason that we're studying these drugs in a combination is because they occur in this combination very frequently. And we noticed that people who co-use tobacco and cannabis are more susceptible to the negative effects. We see that they have more clinical symptoms and they have more difficulty quitting cannabis use. So we're now focusing on how we can better treat these individuals. There is a strong association between cannabis use and the later development of schizophrenia. So it's important to understand that cannabis use does not cause schizophrenia, but it definitely does increase one's risk of developing the disorder, especially when there's other factors that are playing into the association. So things like family history, or maybe a really stressful environmental event that occurred in someone's childhood. So it's a complex interplay, but what we see from research around the world is that cannabis use does increase the risk of developing psychosis. What's interesting about the relationship between cannabis use and psychosis is that people with psychosis often use cannabis in a way to self-medicate. They think it's actually helping their symptoms, but in fact, cannabis use is actually making their symptoms worse. So we find that it increases their hallucinations, their delusions, their anxiety, as well as their depression. It's important to differentiate that psychosis from schizophrenia or a psychotic disorder. So psychosis is a symptom, while psychotic disorders and schizophrenia are disorders. And a lot of people who use cannabis can experience psychosis, especially in the short term. So when people, use a lot of cannabis and they experience this, we call that substance-induced psychosis. And then we have to sort of do a differential diagnosis and then understand, okay, is this psychosis due to a substance, or is it a disorder in itself that was maybe precipitated by cannabis? One of the things that we're learning from new research that's coming out after legalization is that with all these new methods, we're finding that cannabis users who had never used nicotine or tobacco are now using it because their paraphernalia, or however they're administering it, sort of entices them to add tobacco to their joints, or now they're using some sort of like electronic cigarettes, whether they're smoking marijuana or adding tobacco to it. And so now we're seeing that actually, while rates of tobacco use are decreasing in the general population, they're actually remaining stable among cannabis users. And we're not even really sure of all the interactions between cannabis use and tobacco on a clinical level, on like a pharmacological level, on a neural level. And we are seeing a little bit in treatment that if you want to quit cannabis and you're a tobacco user, you're going to have a way harder time than someone who's just a pure cannabis user. We're going to be using MRI to be able to look at the brain and look at how cannabis use affects brain structure as well as brain function. And specifically, we're looking at brain activity while people are completing a memory task inside the scanner. One interesting tidbit of information is that the fastest growing group of cannabis users since legalization is actually among aging adults. So people who are about 55 years and older. And this could be because they think that cannabis actually has a therapeutic effect. And we're hearing that a lot from the media. But people have to be really careful. So they have to understand, what kind of cannabis they're using, and to really maybe talk to their doctor if they think they're using it for therapeutic purposes, because it may not always have their desired effect. We received a HBHL award in January 2020, and thanks to HBHL, I've been able to conduct really innovative research that is allowing us to better understand the effects of cannabis use on the brain in both specialized populations as well as non-psychiatric control. I think addiction treatment really has to be a holistic approach where we take into account, how it affects their social interactions, how it affects their brain, their clinical symptoms, and really treat the entire person and think about that when we treat people.